Good morning, good evening, good night, everyone. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist. And we're talking all things on living agelessly, bridging generational gaps, entrepreneurship life, family caregiving, and all that presents, and then just life itself. But we are also doing a special for Movember, if you have a mustache you grow your mustache for this month. And we're talking all prostate health. And remember last week we started a bit on prostate, and I promised you we're going to have a special guest. And so we do have that special guest here with me. So wherever you are, call a friend, tell a male, tell your spouse, join in, leave your comments below, and like and subscribe because we're going to go some deeper into prostate health. And what better way than to bring an actual male so that you guys can identify because you may not want to listen to me all the time. So welcome, Mr. Lashley. He is a registered pharmacist for many, many years. I know him for at least 200 years. And he's going to be here to talk about your prostate health, what he would suggest, the things from a pharmacist point of view, his own personal story, and some other tidbits and advice for Gents for this month. So welcome so much, Mr. Lashley, and thank you for joining Lana's Little Things here where we talk everything. So we're going to feel free to speak about prostate health and just take your journey away.
Good morning, Lana, Dr. Lana, and I'm happy to be here with you this morning. Um, of course, your topic is a very broad topic, and from a pharmacist point of view, we see many, 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 many men who are suffering from this illness, and we're really into trying to prevent the cancer from forming. So we talk about prostate health in terms of making sure that you're taking your vitamins. One of the areas that we always have problems with is compliance with men. So of course, men would take a longer time to get to their doctor than other persons. But in this area, I find that men are they're very interested in their prostate health. If we can speak about vitamins that strengthen and help the prostate. Now we can go to things like vitamin zinc. We're talking about areas, drugs like vitamin D as one of those drugs, also or those vitamins. We also have prostate that are some drugs that are specific for the prostate gland. And so men will come into the pharmacy and inquire about various areas that they would want to strengthen their prostate gland. So that is something that is a conversation. Of course, we try to encourage men to try to exercise. Of course, you probably would have mentioned some of the factors or things that go against prostate cancer. And one of the areas that we find is persons who are obese. They don't exercise. They don't really do a healthy lifestyle. They eat badly, and then there's other men. There are men who have concomitant illnesses, which like diabetes, hypertension, and these illnesses that contribute in a way because sometimes bad diet, poor lifestyle can contribute to bad prostate health.
So thank you. That's yes, we did talk about that's a mouthful. And that is really just speaking to living well. And persons will say, oh, you're always saying to just live well, but all these things promote the health of cells in general. Would that be true to say?
Oh yeah, definitely, definitely. Cells, it's amazing because the research was show that deterioration of cells in the body can contribute to other types of cancers. But if you strengthen your body and you keep your cells and you keep your body energized and healthy, then your chances of any type of cancer is going to be reduced significantly.
Precisely. Thank you. And thank you so much for those prostate aids you said. We did
Yeah,
speak a bit about vitamin D last week, and there's some research on it, but generally speaking, vitamin D is safe to use. And then there's obviously drinking water, being aware of not smoking, and
yep,
exercise again for just general cellular health. Now, in terms
yep.
of screening, what can you give us a personal story on the screening and the importance of screening and what screening actually, well, you don't have to go into details, too graphic, but whether there's a fear of what screening will do. There's a physical screening, the digital rectal exam that the doctor does, and then there's the blood test. So can you speak to some of that, please, and allay some fears if possible for some who are listening?
Yes, there's always that fear of the digital rectal examination.
Mhm.
Um, that's a big one for men because the men do not like to have that examination, and to convince them of that is always problems. My personal experience in that is that my dad he actually died of prostate cancer, and in the interim, what happened? What was the first sign? Really, was that he started to lose weight, and we couldn't understand what was the issue. But then when he got sick, and my dad is a man that never really gets ill, never got ill really. Um, I never realized my dad. I never saw my dad with a cold, you know.
Wow.
And he was a very strong man. But one of the things that happens, of course, we didn't speak of age, because of age is a major factor when it comes to prostate cancer, as it has been recorded that older men tend to have this problem more than younger men. Of course, there are some stories of younger men, but he started to lose weight, and after that, because he got ill, um, I decided that we needed to do some tests. And while doing those tests, and the test came back, then we recognized that the PSA levels were extremely high.
Wow.
And because of that PSA levels, of course, I have to say that prostate specific antigen is what PSA stands for.
Mhm.
And that is the test that shows whether or not there is problems in the prostate gland. So that was the first indicator of that with my dad. And then I decided that, well, I wanted to have a more confirmatory test, because that was done by the GP. And
Mhm.
then we then proceeded to do the test with the specialist
Right.
in that area. And from then we recognized that it has metastasized to the bone. And when I say metastasized, it has spread to the bone from the prostate gland, because as you know, Dr. Lana, um, once that prostate gland is infected, it then can affect other cells in the body, and then it spreads to other areas. So from there, then we went to, of course, what is going to be the treatment for him. Now, this is a man that is 80, was 80 years old.
Mhm.
Never was really sick or anything like that. But here we are. So we had to decide, well, what is going to be the treatment? So we had three options at the time. You would know that in terms of if we can go into treatment now, um, you would have known that there is oral tablets,
Mhm.
and we can go into some of those drugs when I complete my little statement. We also have the injectable
Mhm.
that can be used to suppress the growth of the actual cells in the prostate. And then, of course, we have removal or operation of the removal of the prostate gland. Sorry, well, if you have removal of the prostate gland, or of late, there's no injecting pellets into the actual prostate gland to actually suppress the growth from that point of view. The other option that the doctor at the time had stated was removal of the testicles.
Mm-hmm.
Now, as you as a doctor may know, testosterone, which is the male hormone,
Mm-hmm.
tends to increase the risk of men in terms of the prostate gland, in terms of the actual disease. So once that is, of course, you know what the function, I know you would have gone through what the function of the prostate gland is and so on in terms of reproduction. So therefore, that in itself would have removed, if you remove the testicles, then the testosterone level would have been lower. And then chances of maybe survival or longer life
Mm-hmm.
would have been there. So those were the options. And now, if you most men, especially men of older ages, they do not like operations.
No.
They don't like operations at all. So my father quickly said, no operation. And so we sat as a family and we actually, because that's where it has to come to a family discussion. And because of our close-knit family, we sat and discussed it with him, of course.
Mm-hmm.
And he didn't want that at all. So we went to tablets, and he didn't like the fact that he asked about the side effect profile of the tablets. Of course, the side effect profile of tablets, I mean, every drug have a side effect. I find that men turn away from the sometimes of the side effect profiles. I mean, sometimes these drugs can cause a lot of headache. Sometimes in some men, it can also cause nausea, vomiting, sometimes in some cases. So men will turn away from tablets because that's why compliance is so poor.
Mm-hmm.
So then at the end of the day, then we ended up with opting for the monthly injection.
Mm-hmm. Okay.
And yeah, and that monthly injection is has to be done every month, and that can be done by the patient. Of course, me being the pharmacist, I administered my dad's injection every month
Mm-hmm.
because as a pharmacist, we are still trained in administering injections in our course, so it's not something new to us. However, um, that that is the story. I mean, my dad ended up living for probably about 5 years after diagnosis. So
Really?
that was really good. I mean, he got back his strength. He was because he was a mason, and so he was retired at that time. But
Right.
my dad always found something to do at home,
Mm-hmm.
and so all of a sudden he started to do things around the house and all of that, and we were very happy about that. And but 5 years in the scheme of things, having metastasized to the bone, that was long as far as I'm concerned. Because some persons, when that has done, you would know, Dr. Lana, that once it metastasizes, there's no real control per
Yeah.
se after that,
You're
right?
on borrowed time, counting time. So to have
Yeah,
gained 5 years
e-
is
exactly. Yeah.
wonderful. And we're not
So that,
advertising any particular thing here. We just want to say, but we're helping persons to make an informed choice. So you have
yes,
the choice of tablets and be informed of the good and the pros and the cons. So
of course,
and pros and cons financially, pros and cons health wise, what you can do, and everyone's there's going to be given the information so that you can make the decision, talk as a family, as you said, include the person for sure, and let them have a say in the matter. Because one thing about aging is the feeling of loss of control. And then, of course, you bring an illness. That also makes you feel like you're losing control. And you add cancer to that. Well, so they're all things in the mix. So the more we talk, and that's why we're always having conversation, and I encourage conversation, the more we're informed, the more we talk about it, the better, the more we'll come to the table. And then the fears might not be gone, but at least you have an idea of what to do and not feel so by yourself. So I think that is an amazing bit of information. That's previous health would obviously have helped to contribute to him being able to sustain the medication too, in addition to
of course.
the
Yeah.
vitamins. So that is
One
a
one
plus for being healthy
one one of the
all ages.
things one of the things, Dr. Lana, too, is that it is very important to have that screening. It's very important to have regular checks with your doctor. One never knows when something will turn up. And prostate gland, in terms of symptomology, very, very, very asymptomatic, meaning that sometimes you don't even have, you don't feel a pain, you don't feel nothing sometimes. But the PSA levels jump up. Yes, you may have issues with urination, you may have pain in the bone, and sometimes men put it down to, oh, I work hard. I'm a hard worker. I am out there in the sun, so things can happen. But if you are having regular checks, then you would know what your blood pressure is, your blood sugar is, you know what your PSA levels are. So you know that once you have done your blood work with your doctor and you're being managed by your doctor as a man, anything slight happening, you are going to know because it's going to be highlighted in your blood work or of your doctor. So it's very important to have that screening, have that regular conversation with your doctor, have that regular conversation with your pharmacist, because we are here also to make sure that the treatment, the condition is understood. Because sometimes I know, I mean, I don't like to say it, but 10, 15 minutes in the doctor's office is not always ideal for all the information that they should get. So when they come to the pharmacy, and we have areas where we can actually discuss with our patients where the problem lies. So therefore, we can bring them and make them more aware, make them more comfortable. Because sometimes what happens is that most of the time persons get so scared, they don't even want to go to the doctor. I was just speaking to someone and he was told that he had to go to the hospital, and he said he ain't going to the hospital despite whatever. And that had to be a conversation, because we had to understand that, well, there's no other way that you're going to get this type of treatment if you don't go to the QH. And that is also the fear in some instances also, Dr. Lana. One of the things I wanted to mention to you also was, which I forgot earlier, was the herbal factor, and the herbal factor of herbs that are used in the prevention or and also to the strengthening of the prostate gland. So we have items like saw palmetto. We have there's another one, newer one that has just been out on the market. I can't remember exactly the name now, but they're always herbal substances that are there. Of course, the research is still ongoing on herbs, but at the end of the day, we're still having persons who are having great health with various herbs. And those herbs, of course, you come to the pharmacy, and of course, we can discuss that with you in terms of your health and your prostate gland.
Awesome. So as we wrap up, thank you very much. That was, well, more obviously always gains so much when I talk to you. And I'm sure that the males who are watching, or the spouses of males who tell them to watch, will be more informed and encouraged, because you did go from start to basically from screening to treatment and then included an experience in there which was positive. So all experiences with prostate cancer, most experiences are actually positive, but the important thing is to screen. We don't know what's there unless we check for it. And there's no doctor and no pharmacist in this world that can tell you if something's wrong with your cells unless they're screening. And there are always, plugs for, well, but you can screen this way, you can screen that way. What we're suggesting, advising is at least have the conversation, as you said, with your doctor, with your pharmacist. You might trust the pharmacist, you might know them longer. And that's what happens quite often. You have more time to say other things with the pharmacist. And I know you really do make a point of the holistic care. All pharmacists tend to make that holistic lifestyle a better part. It's not just putting drugs on persons. So that was wonderful. Thank you so much for that information and for your personal experience and encouraging males. There's nothing painful, wrong, strange, dangerous about the digital rectal examination. I can only say that from my end. Mr. Lashley has just informed you that from his side as a patient, it is. You would absolutely okay, right, Mr. Lashley? You're good with that.
Yes, I'm good with that. That was all right. I mean, it again is a lot of psychology going in there and information, and that's why it's important that information and education is important, because if you don't have that education, then the fears that you have will never be eliminated. And I believe that we as practitioners, we have to make sure that we give that information and we educate our patients on these various things to alleviate some of the fears, because there are a lot of fears out there for that examination for men.
That's true. And I am sure, I feel like you have allayed many of those. So again, so those watching, thank you so much. Thank you very much, Mr. Lashley, as usual.
You're welcome.
And want to say before we go, have a chat with your neighborhood pharmacist. We're continuing prostate health and general men's health for the month of November on Lana's Little Things. And remember to join me on lanaslittleThings.com. You'll get this episode repeated as well because the YouTube is uploaded, as well as the course for caregivers is also going to be ready for you. So any of you who are caregivers, any of you who want to, if you have a medical question, feel free to email me or sign up at lanaslittleThings.com, and I'll be happy to answer any questions that I can. Remember to check
Before you
your
finish,
doc.
before you finish, Dr. Lana, if I
Yes.
can put in a little plug for my pharmacy where we are, and
In
where you, if you
Barbados,
can
we're
come,
talking, yes.
yes, you can come into our pharmacy. Our pharmacy is located in the One Accord Plaza. It's called Round Hay Pharmacy, and we offer advice in terms of our counseling area. So you can come in. We're there from 8:30 in the morning to 5:30 in the evening, Monday to Friday. Saturdays we're there from 9 till 4. Sundays we're there from 9 till 2. And you can have a personal consultation with your pharmacist to have discussions about your prostate health and also other types of health that you may need information on.
That's
Thank
awesome.
you.
What could be better? Couldn't have said it better. What could be better than that? Having you had two for the price of one, and talk to your doctor. Have the conversation, allay your fears, talk with your family, and if a decision does have to be made, by all means, have it. So good morning. In this case, it is morning. Miss Lashley's joining us on morning. It's usually night, but wherever you are, good morning, good evening, good night. Thank you, Mr. Lashley. From my heart to yours, Dr. Lana and Mr. Lashley signing out and saying good health to you. See you next week. Bye-bye.
Bye bye.